Hi Emily, my name is Caitlin Hunt, and I'm currently getting my master's degree at John Jay College of Criminal Justice. Since I do not have my license or my degree yet, I'm actually being supervised by individuals who do have their license. They'll be following me throughout my time getting my master's, and do you have any questions about that?
None that I can think of.
And how are you feeling about this?
It's alright. I'm okay with it.
So no concerns about therapy so far?
Nope.
Okay, so I do have all of this information that you have completed, but can you actually just tell me in your own words how you've been feeling lately?
Well, lately I've been becoming more depressed, and it's been harder to motivate myself to leave the house, even my bed. Sometimes I just stay in my bed all day.
Oh, okay. And how have you been feeling otherwise? Have you been feeling sad?
I've been getting a bit nervous because with my lack of motivation to get out of bed, I've been staying home more and more for work, and I've been missing more classes.
Okay.
So I'm just wondering how that would end up affecting me.
Of course, that's definitely a valid concern. How many days would you say on average a week are you missing because of your inability to get out of bed?
I'd say the most I've missed is about 3 or 4, but on
Okay.
average it's around 2 or 3.
And when you speak to your boss, have you spoken to your boss about this?
I've spoken to my boss a little bit, but
Okay.
not too much relating to how I'm actually feeling,
Okay.
because it's my boss and I don't want to bring emotions into work.
Of course, I definitely understand. Now, a little bit more about your symptoms. I know you said you don't have the motivation to get out of bed, and you've been feeling a little nervous, maybe even anxious
Yeah.
about the schoolwork and the jobs that you're missing. Have you ever sought counseling before?
It's not one of the things I've done before,
Okay.
no, but I felt like it would help out if I came to see a counselor.
Definitely. And have you ever felt these symptoms before? Any of these?
Once or twice a couple years ago,
Okay.
but it was nothing as severe as it is now.
Gotcha. So you weren't missing work. You weren't.
No.
Okay. So you basically had a handle on that one. Where this one you feel like you should really speak to someone.
Yeah.
And that's really good that you're reaching out, because I definitely think therapy is for you, and it'll be able to help you out. Has anyone in your family ever had depression or has been depressed in the past?
I'm pretty sure my mom has had a little bit of depression.
Okay.
But she always kind of just waited it out for the depression to somewhat go away, and then she would just be back to doing her normal schedule.
Okay, so she's never gone to a doctor?
No, she hasn't.
Okay, and she's never been on medication or anything?
Not that I'm aware of, no.
Okay, and your mom's the only one that's ever had depression? Or has had symptoms of depression?
Yeah, in my family. Yeah.
Okay. Medical-wise, are you healthy? Do you have anything?
Now that you bring it up, I've been realizing that I haven't been feeling the need to eat a lot more.
Oh, okay. So when you're saying you haven't been feeling the need to eat, there's no appetite, you won't eat breakfast, or you'll eat less?
Earlier on, when I started first feeling it, I just ate a little bit less each day.
Okay.
But now, I don't really feel an appetite. I just don't feel the need to eat.
Okay. Well, that's definitely cause for concern, because as you know, you need nutrition to make yourself motivated and to give you the energy. So I think maybe if you would try to eat a little bit more, maybe you'll have the energy to get out and be able to do things. Your family life, how's your family life going?
My family life is okay.
Okay.
We fight like any normal family does. But it's nothing that I would think is wrong.
Okay. Well, that sounds good. And can you tell me what members are in your family? You have a mother?
I have a mother, a father, and then I have an older sister and brother.
Okay. And is your brother older than you as well?
Yeah.
And how's your relationship with them?
It's good. We get along. Of course, we argue sometimes.
Of course.
But it's alright.
Social, just a little bit about your social life. I know you put that it's been suffering since you've been feeling depressed lately. I know you are an 18-year-old, just started college, so I know people like to go out. Were you going out earlier?
Back in the beginning of the year, I was going out a lot with my friends, but I really started slowing down going out as the months went on. Now it's just a very rare occurrence for me to go out with my friends.
Okay, and what do your friends say about this? Are they there to comfort you? Are they to help you? Do they know anything about this?
Originally, they would try to encourage me to come out, but the more I said no, I think the more frustrated they became with it.
Discouraged.
So I guess they just decided, okay, she's not going to come out. Let's just leave it alone.
So that's probably been making you feel pretty isolated, huh?
Yeah, it made me feel like I was pushing my friends away by, like, feeling depressed like this, and so I guess I stopped trying to reach out to them because I didn't want to trouble them with it.
I definitely understand. And work-wise, I know you were saying that you've been missing a couple days of work a week because of your lack of motivation. Can you tell me about work a little bit? What do you do?
Well, I work in stores in the mall. I do a little bit of retail. So it's not like missing one day of work would have been that big a deal, but it's like a consistent of at least like 1 or 2 days a week.
Okay.
And so it was alright to miss a few, but like now my boss is getting upset with me that she doesn't have people to run the store, and so I guess no matter what I do, I just can't get motivated to go to my work.
No, and I could definitely see that as being a problem because work is important, of course. And I just want to let you know before we go any further that everything that you say here is just between me and you. But there are some exceptions. If you say anything that says that you're going to put yourself or others at risk, I do have to disclose that to somebody else because obviously I need to seek help for you or whoever else needs help. Or if you mention anything about child abuse. Okay. So that's definitely something that I have to tell them about. Otherwise, everything you say here is between me and you, and it's definitely confidential. And I just want to tell you a little bit more about myself. I'm a cognitive behavioral therapist, which basically just means that I discuss a patient's thoughts and their feelings, and with those thoughts and feelings, together we work on it to try and alter some of those thoughts to be more positive and to try and get like stronger, better feelings out of the person.
It sounds like exactly what I need.
Yes, cognitive behavioral therapy actually has been shown to work with depressed patients as well as patients with anxiety, which it sounds like you have a little bit of anxiety. Now what we're going to talk about is a goal list. Okay. I know this seems a lot, but things that you want to get out of therapy, which hopefully I'll be able to help you with and we can work together on. Do you have something that you'd want to start with?
I think to start, it would probably going out to hang out with my friends more.
Okay, so friends is definitely important to you. And then, so that would be motivation to go out with your friends and just to get out of bed and do that sort of thing. Okay, so definitely want to work on your motivation. And I know that also goes with work and schoolwork as well.
Definitely.
So basically just social life, get your social life back, get back together with the whole work thing, and just do better in school. Yeah. I can understand that. Other goals?
I think it would just be to not stay in bed all day. Like, I know that's a simple goal for some people, but, like, for me, just, like, being able to get out of bed and, like, just not lay there, just
no, definitely.
24/7.
You are showing symptoms of depression, which that is actually a diagnosable disorder with symptoms. So it's not that you're being lazy or that your friends are saying, oh, you just don't want to hang out with us. There is actually something in your brain that's making you feel that way. So hopefully with these therapy sessions, we can alter those negative thoughts and it will help you to become more motivated.
So it's reassuring that, like, it's not just me being lazy. No. That there's, like, actually something that's making me do these things.
Yes, of course. And then while you're dealing with this, it'll definitely help you become a happier person, maybe more motivated, maybe more outgoing, kind of get you back to the person that you want to be.
Well, that's really good.
Good. Any other goals that you want to go over?
I'm positive I'll have more the next time we see each other.
Of course.
These are just the ones I can think of for this appointment.
And especially because this is the first session, we can always add more goals to it. And as you go through therapy, if you achieve some of these goals, we can definitely add some new ones on. So this isn't set in stone. It's like therapy. It's just going to continue to get better. Okay. And I'm really confident that we can work together and achieve as many goals that are on your list.
Well, thank you for helping me out with all this.
No problem, and I look forward to the therapy.
So do I.
Okay.